Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by my white or dark meat, Dr. Martin.
I like both.
By my white and dark meat co-host, Dr. Jason Martin. If you hadn't guessed, it's November 1st, so all the spooky is behind us, and the turkeys. Cue the turkeys, Nils. Cue the turkeys.
Who knows what this turkey is going to be? Nils is a turkey.
Yes, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Good. Just got out of surgery. Still have my surgery cap on.
Yes, I know. I took mine off. I always try not to make it too tight on days we're podcasting after we do surgery so it doesn't leave the line on my forehead. I was wearing it real loose today. Had a real loose surgical cap.
I didn't have enough time to get rid of the line, so I just kept it on.
Yeah, there you go. Well, we have a great topic. This is actually a bit two-parter. This is everything you need to know about liposuction. So if you are listening to this podcast and you would like to watch it, you can find us on YouTube. You can find all of our social media handles here, including TikTok. We're a pretty big deal on TikTok.
We are huge.
Yeah. Also, you can leave us a voicemail.
I mean, how big are we on TikTok, Amy? Let me just delve into this.
Yeah, we're not. That number is 303-630-9038. And interestingly enough, the reason we were talking today all about liposuction is because I would have guessed that our last liposuction episode where we really went into it was, I don't know, like 2 years ago. Well, I was looking to send one to someone recently and found out that the last time we really talked about liposuction as a procedure, not just as myths, was back in 2021.
Right in the middle of COVID.
It was at the beginning of 2021. That's the word we can't say or we kicked off YouTube.
Oh, okay.
Yeah.
The C word.
Yeah.
That has a whole other double entendre to it.
So I figured it was time.
You can't say that one either.
You can't say that one either.
That'll
Is
also
there any C word you could say, Nils?
Yes. So before we get into it, though, I feel like Element knows our podcasting schedule because just this week, as we were getting ready to start podcasting, this beautiful box showed up. It says, "'Tis the season to share the salt."
Oh, nice.
And I have not opened it, so I'm going to open it and see what's in it. It sounds like a number of things. I'm hoping it's the new chocolate flavors for this year because if you guys don't know, we love Element, and in the winter they do like flavors that you can mix into warm water. And
which I never do.
They're chocolate flavored. I put them in my coffee, which I know sounds weird. You don't want your coffee to be salty, but I love it. So
what does salty coffee taste like?
Tastes like salty coffee.
Okay, thanks.
I mean, that's there's no better way to describe it. Some things you just have to find out for yourself. There's a C word. You can say coffee.
Coffee? I could say coffee? Okay.
Yes. All right. So let's see what Element sent us.
Oh, yeah. Here we go.
Oh my goodness. So we have Element to share. So it is the 3 packs of these are the chocolate flavors. So this year we've got chocolate raspberry, chocolate mint, and chocolate chai. Ooh.
Yeah, I do chocolate chai. That sounds pretty good.
Yeah, and the chocolate mint they've had before, and a recipe book. You know, they've still never hit me up to have me make recipes for them. Look at that, salty coffee.
It's probably just slipped their mind, Amy.
It probably has.
Yeah.
Designed to be enjoyed hot and swirled into your favorite recipes. The chocolate medley invites you to bring the heat so you can stay salty all winter long. Salt softens bitterness to bring out coffee's natural sweetness and add an extra pep to your step. Elevate your morning coffee routine with any of our chocolate flavors.
Nice.
There you go. Yeah. It says start with half a stick and dial up the taste. I usually I do the whole one. Ooh, raspberry hot chocolate, peppermint mocha.
I think the chai one in coffee might be pretty good, right?
Yeah, I think you could just make a chocolate chai just with hot water.
Yeah.
Ooh, exciting.
Okay.
Yay. Well, thank you all so much. So this was from Element. Thank you for being an Element Insider. This gift invites you to share the salt. So we will definitely share the salt. Yay. All right. Well, that was fun. Thank you, Element. We love you. So now that we got that out of the way, should we talk all about liposuction?
Oh, yes.
Everything you need to know about liposuction?
We know it all, and we're going to give it to you now.
This is part 1. So we're going to this is not going to go into specifics about the procedure itself in this episode. That'll be in episode 2. So we're going to kind of cover everything from start to finish, literally starting with the statistics. I had to pause.
Wait. How many years have we been doing this? And how many years have you been messing up statistics? So liposuction is a very common procedure, even in 2020, which is still the year we're going to for statistics. We had over 211,000 liposuction procedures performed. It was slightly down from 2019 because of that C word that we can't say. Coffee.
Because of the coffee.
Coffee with chai.
Yes.
Another C word.
Slightly more women than men by, 4 times, right? 188,000 women to 22,000 men. Now, of course, these are procedures performed by board-certified plastic surgeons. There are other doctors who do liposuction. We'll talk more about how you can choose a surgeon. Biggest age range here is our typical 20 to 40 is probably your biggest age range, and then still stays, I mean, over 3,000 people in their 70s. But we do a lot of liposuction on people in their 70s.
We do a lot of liposuction on people in their 60s and 70s, at least in our area. Again, we're in a very healthy area. These people are healthy. They don't have a lot of medical problems. So our distribution would be different than what it's showing here.
We're pretty similar. With our biggest being like late 40s to
55
mid-50s.
to 69. Yeah, you're right. You're right.
Yeah. So a lot of liposuction being done. It's a very common procedure. I think it's kind of a misunderstood procedure too. And that's why I'm glad we're really doing this like deep dive.
Yeah.
Yeah. All right. So what are some of the things that liposuction can do?
Okay. It can definitely remove fat that you don't want. Okay. At its baseline.
Yes. It is meant to remove fat.
Yeah. It's not meant to remove fat all over your body.
Well, that's what it can't do. That's our next slide.
Okay. All right. So, and if you remove fat specifically in certain areas, you can improve your body contour, right? So if that's your hips, you can make your hips look better, your arms, your neck. These are usually areas of fat that are resistant to diet and exercise, or for women, they tend to be hormonally driven. You see men. The upper hips or flank area, the abdomen, these are the areas that people carry fat, usually hormone driven. It can make you feel better about your body in terms of the way it looks. It definitely can make clothing fit better for sure. That's a common thing we hear in our clinic, that you do liposuction even in a small area. Oh, my pants fit better, or my shirt fits better.
Especially with outer thighs and arms.
Totally. And neck, or I look better. My shirts, for men, we can do liposuction in the neck. My button-up shirt looks better. I don't look heavy in my neck area. So it's a pretty powerful procedure. Would you agree with that?
Yeah. I don't know if I'd go that far, but yes. Yeah.
Yeah. Amy's a hater. That's okay. Yeah. I'm not a liposuction hater.
No, I'm not either. I don't know if I'd go that far with it, but yeah.
Yeah. It's one of the most universal procedures we do. It's one of the most common procedures we do. And if it wasn't a powerful transformative procedure, it wouldn't be the most common procedure we do, period. Next slide. Thanks.
Guess I got schooled on that one. Wow.
Mic drop.
Yeah. Whew. Okay. So here's some areas. Let's talk first about what liposuction can't do.
Okay. Yeah. You want me to do it? Okay. Yeah.
Yeah. You're on a roll, man. Okay. I'm not going to stop you. You are on a roll.
So it's definitely not a weight loss method. And we have this conversation all the time, and Amy can go into detail on this, but liposuction, even aggressive liposuction, how many pounds are you removing, Amy?
I wouldn't even go there with pounds. Yeah. Because it doesn't really correlate.
Okay.
Yeah.
In a similar vein, it does not treat obesity at all. If you are obese or if you struggle with weight, if your BMI is elevated, liposuction is not the answer. And that's the really common fallacy that people approach liposuction with. And I think some of the purveyors of liposuction, the people that offer it, don't address this directly. So people are frustrated afterwards that maybe their weight is the same or they feel heavy. It's not in place of diet and exercise. We tell our patients all the time it's adjunctive. So if you have a good diet or you're focusing on nutrition, you're focusing on exercise, that liposuction is adjunctive. It can help, but it's not going to trade out for those other issues. How many patients come in wanting liposuction and not wanting to diet and exercise in our office, Amy? It's
rare in our office, but I would say universally it's probably pretty common because people do think that liposuction is a weight loss procedure and it's not.
Right.
Yeah.
Cellulite, why don't you handle this one, man?
So we'll talk a lot more about this when we talk about some of the risks and complications that can happen with liposuction, but it does not treat cellulite. In fact, in almost all cases, if you aggressively treat an area of cellulite with liposuction, it will likely look worse.
Yeah.
It also doesn't remove or tighten, or it doesn't remove or pull skin. Let's put it that way.
Yeah.
So it does not remove excess skin and it does not pull skin. It also does not prevent future weight gain because all the cells in your body are we talk a lot about fat. So our episode about fat, let's talk about fat. We talk about fat as an organ system in the body, and it's hormonally driven. It is signaled by a lot of different factors, and every single fat cell has the ability to grow and to shrink. So if you remove, here's my jar of marbles. I need to actually get a jar of marbles.
This is such a Groundhog Day because I loved this metaphor or analogy.
Yeah, well,
I really did.
I use it all the time. So if you have a jar of marbles that has 100 marbles and you take out 80, there's still 20 marbles there. Well, these are magic marbles and they can grow. So those 20 magic marbles can still grow, but they're never going to fill that jar because even if they grew to, way bigger than they are. However, The other marbles in your body, the other jars that still have 100, those ones start growing, and what happens? They overflow.
Yeah, that's why
that overflows the jar.
That's where you get the lipo in the hips and the fat neck 6 months later. It didn't go there. You just gained weight.
You gained weight. Yep.
Is that derogatory to say it that way?
No, that's what we tell patients.
Right,
I mean, because it's a myth, like, or that somehow that fat will migrate, or that there was a theory for some time that your body would have this, and we talked about this in our myths episode, had some type of like fat set point where like if you took out fat cells, that it would work extra hard to like plump up the other ones.
Yeah.
That's just not real either. So that was, I mean, it was a small study, but it was not found to be true. And anecdotally, I mean, we've done thousands of liposuction procedures, and that's just not.
So this is morbid, but I just want to say, like, you know, unfortunately people do get amputations and things like that, right? For diabetes, for trauma. It's not like so you're removing literal fat cells. It's not like those people gain weight right afterwards because the body wants a certain set point.
Exactly. I think that's a good way to put it. And your body also doesn't try and like gain the weight of the limb that's lost.
Right.
Like it doesn't, it's not
so
like that.
inane,
Yeah.
you know.
It's not like that, but I get it. And
it had to be a plastic surgeon that came up with this because their head is so far in the clouds sometimes.
Well, but I understand the concern with people, right? And we'll talk more about, you know, the things you can do after liposuction to maintain your results. So what are some of the areas that are ideal for liposuction?
I'm looking at this list, but what first came in my mind was the abdomen and flanks.
Like the trunk.
The belly, the torso, that area. That's one of the most common areas we do in our office. And I'm sure if you look at the stratification, that's probably the most common area in the United States.
Especially for men, like the spare tire, you know, women, the muffin top, bra fat. Yeah, your whole trunk is ideal, especially for men. The chest, you know.
Yeah, gynecomastia, huge. There's two different types of gynecomastia. There's primary gynecomastia, which is the breast bud or breast development, and then there's secondary or pseudo gynecomastia. I forget the clinical term, which is more fat related. And the fat, a lot of people have pseudo gynecomastia, and that is very, very sensitive and responds well to liposuction. But then you have like special areas like underneath the chin, the upper arms, the calves and ankles. It's a very specific area to treat. It's kind of hard to do. The thighs, that's a common one. Buffalo hump, which is one that people don't usually think of, which is your upper back, and it's associated with polycystic ovarian disease. You see a lot of people with PCOS have buffalo humps associated with that presentation.
Yeah. And I think the big thing here with a lot of these areas is they're areas that are not easy to lose weight from per se, like the calves and ankles. Like if you got heavy ankles and that's just you, like it's really you cannot spot reduce. We all know that, but that's an area that's probably gonna be the last thing to go.
I don't feel like your ankles are heavy.
They're not, but we've had patients who are.
Yeah, that's true.
And it's always a little bit strange. Or the woman who had just the really big arms on a really small person.
Yeah, we've seen that.
Yeah.
We had that patient who had a lot of weight loss, so maybe this is associated with it, and lost weight everywhere but her thighs.
Yeah.
You know, her thighs were so much disproportionate to her body itself.
Or we have literally a model, an actual legitimate model who had the biggest saddlebags I've ever seen on a person. And she's never been overweight.
No, never. She was like normal weight.
She's low weight. She's an actual model.
Yeah, it's crazy.
Yeah. So liposuction is really great at just treating those areas where you have unusual fat deposits. Again, it's not for weight loss. You're not going to lose a lot of weight with liposuction. And it's dangerous to try to use liposuction for weight loss. Like it can actually be very dangerous to do that. So we'll talk more about that in the risk and complications.
Yeah. You just set me up. That was like a T-ball on a tee.
I was trying not to
hit that out of the park.
Yep, we'll talk about that.
You can't do that to me. Just like dangling in front of me. Like,
why can't you do 7 liters of liposuction?
Oh my God, stop. Okay. Hurtful.
Hurtful. All right. Well, let's take a quick break. And when we come back, we're going to talk about how to find a surgeon, pre and post-op appointments, all that kind of good stuff. We're back. I feel like I should have some like punny things to say about liposuction, but I don't.
I really don't either. I think it's so much a part of what we do.
Is it because it's so powerful?
It is so transformative.
You can't even joke on it because it's too powerful.
Yeah, it is.
It's because you guys don't suck.
Yeah.
Ah, there we go. Ha. Ding. Perfect timing, Nils. Got that comedic timing.
You were working on that for a couple minutes there?
I got the better out.
Yeah.
He was waiting. Yeah. Like, all right. It's like the vacuum. Like, this thing sucks.
Yeah.
Okay. All right. So let's talk about who's a good candidate.
First and foremost, Amy, what do we always say? Healthy enough for surgery. That
because
means
this is elective.
It's elective. You don't have diabetes. If you do have diabetes, it's very well controlled. You don't have high blood pressure. You don't have
You're not on blood thinners.
You don't have a heart history where maybe you've had a heart attack and have compromise there. Your lungs work well. You are able to walk around, etc. You live a healthy life, non-smoking, minimal drinking, and you're at a stable weight. That's like the biggest kind of criteria that I think that we have, a maintainable weight. It doesn't have to be a perfect weight.
That's why it's called your happy weight.
Happy weight. Thank you.
The weight that you are happy being at.
Happy weight. Yeah. A weight that your body feels okay.
Yep.
That's important.
You're not struggling to maintain it. If you stayed that weight, it would be fine. Again, liposuction is not for weight loss, and it's also not going to motivate you to lose weight. A lot of people come in and say that, like, oh, I'm just going to get this lipo and I'm going to be super excited to lose weight. Like, how about we get you to a happy weight first, or within at least, 10 pounds of your happy weight, and then you do the liposuction. Right. Like, this is not the way to jumpstart your 50-pound weight loss.
Right.
It just isn't. Yeah. Good skin integrity.
It's a good way to end it, though.
Yeah, that's what I mean.
Yeah.
Good skin integrity and muscle tone. Those are key things, because when you remove a lot of fat, if you have nothing going on underneath and your skin integrity is bad, that skin's not going to look very good.
Right.
It's going to potentially be a
little
little
Is this where you talk about the couch, the outside and the inside, or we're going to skip that one?
Well, that's more for facelifts.
Okay,
that's when we're actually pulling skin, because we're not pulling skin here.
Got it.
This is literally just taking the stuffing out of the couch and doing nothing.
Yes.
So, yeah. You have excess fat deposits, especially in areas that are resistant to diet and exercise. And what else? The very last one.
Yeah, this is super important to have a positive body image, positive outlook, and realistic body contouring goals, right? So hopefully you go to a board certified plastic surgeon. Hopefully they tell you honest and realistic expectations that you should have. And many times, maybe Amy and I can argue about this, but it is transformative. You can have pretty amazing results.
Oh, you can have amazing results. I'm not arguing that.
Yeah. But it's not going to solve all your body problems. It doesn't matter how aggressive you do with liposuction. Even if you're someone of like a very good weight and in shape, liposuction, again,
it's the cherry on top.
Yeah, it's adjunctive. It makes things better, but it doesn't solve problems. A tummy tuck can solve a problem.
So can a facelift.
Facelift can solve a problem. A breast augmentation.
Lipo can solve a problem. Oh, 100% it can.
But okay, yeah.
Yeah. See, who's dogging on liposuction now?
Right.
You think those saddlebags aren't gone forever? They are.
Okay, so it's what I'm saying, it's not as definitive maybe as some of those other surgeries. Me personally, as the surgeon, I love liposuction. I get to contour, sculpt things. It gets into my artistic feels, and you can really see a change on the table when you're doing it. I love that part of it. Breast aug's the same way. But it's for a subset of people, and it just makes things better. I guess that's the way I would say it. So you got to start from an area of positivity. So it's not going to go in there and change everything about your body.
Yeah. And also, no matter what Sonabella tells you, liposuction is not a replacement for a tummy tuck. So that's the realistic part.
What?
Yeah.
Are you sure?
Yeah. I've seen the YouTube ads. It's not real.
But I saw this on TV.
But being realistic about what liposuction can accomplish, I mean, this is a conversation we have with patients all the time. You need to have a good understanding of what is actually achievable with liposuction.
I feel like the Sonabella commercials are like ED commercials. It's always the same actors with the same like filter on it. It's very saccharine. Yeah, and vague.
Yeah, vague. All right. So there are many types of liposuction, but they're all doing the same thing. Like, you're sucking the fat out through some way. So there's traditional, you numb the area, you suck the fat out with nothing else. Just one cannula in, one cannula out. Power assisted, Dr. Martin loves it. We call it the PALS.
The PALS.
I joke with the OR that they have two PALS now, and I'm like, give him both. He will two-handed.
Both hands.
Yes.
Both hands.
Yeah. So what that does is it just...
If I had a third hand, I would use that one too.
Like that, it just is like it's amplified. So power assisted, I think, is usually really only done when people are asleep, because it's pretty aggressive to do that.
You can do it with you awake, but it definitely can be more sensitive if you use it.
But that's faster. It's just like faster liposuction.
Yeah, we've used almost all of them.
Yeah.
Ultrasound assisted, which originally the one in the market was Vaser, VASER. That uses ultrasound energy to melt the fat.
Vibrates them.
And vibrates it off. It creates these things in the fluid called cavitations, and it pops off the fat globules like grapes in a winery. Radiofrequency assisted liposuction is what we do in this office. It's probably the best on the market. The one we use is Body Tight. We have something with Body
technology.
Tight on it. Yeah, I don't know. There, Nils will show you.
Skin tightening technology.
Yeah, I have 1,000 million videos on that. And that really has the best skin tightening quality to it. It tightens the skin using, at least in Body Tight's bipolar radio frequency energy. We used to use laser assisted, which was smart lipo. I almost forgot what the name was.
Smart lipo.
Triplex.
And
the triplex, which used 3 different laser wavelengths. And I actually think that was really good. Mm-hmm. That was a little unruly. I like the radio frequency better. Water assisted, I've never really been enamored by. No. Don't really think much. And then a combination above. I've used radio frequency assisted with power assisted. To be honest with you, if you're going to an office that really specializes in body contouring, they should have some of these devices around.
Yeah. But at the end of the day, none of these technologies that are listed below traditional are going to make up for technique that is lacking.
Or bad choice of you as a patient for this procedure.
Exactly.
So this only makes it a little bit better. It doesn't solve
in the right hands.
The baseline problem.
Yeah, you could have the best, most amazing technology on the market. In the wrong hands is not going to give you a great result.
Did you say that to Elon Musk or?
I don't know. Did Elon Musk buy a lipo machine?
No, the Teslas are just driving off the road. Like, you can have it. The best technology.
Okay.
They're still driving off the road. Whatever.
Yeah.
Okay, it's fine.
I wasn't sure where you were going with that one.
Yeah.
I'm not as cool as you. I don't have a self-driving car.
Elon Musk is
I drive a car that it has a CD player on it still because I love my old Audi.
I like to drive. Just so you know, like
that's why I still have my Audi.
Right, I like to have my hand on the wheel. Like I enjoy it.
Yeah, I love to drive.
My Volkswagen
right?
Classic still has the roll down window.
Yes.
Jeez,
It's
standard.
That's when you know you're OG and you put an 8-track in there and you really go all the way with it.
Yeah. I had someone offer me a lot of money for it because it's in such good shape. I'm like, no, that's my baby. I'm keeping it.
Yeah.
Nice.
All right. So here's the important slide. Choosing a surgeon. We have and I keep saying this, we have a vast catalog of podcasts, but one of my favorite ones is the New Beauty Guide, How to Choose a Surgeon, which I think came out in 2022.
Yep.
Amazing episode. Everything in it holds true today. Please go back and listen to that before you choose a surgeon. But as a reminder, there is no American Board of Medical Specialties that recognizes a certifying board with cosmetic surgery in its name. So if you are going to someone who is cosmetic surgery board certified, it is not the same as going to an American Board of Plastic Surgery board certified plastic surgeon.
Yeah.
Totally different. And you can find out why if you listen to that episode. So you want to make sure you find someone who is a board certified plastic surgeon. They have results in aesthetic that match your desired outcome.
Look at the before and afters. Look at their results.
And
see
listen
if you like
to
them.
what they say.
Yeah.
Especially if it's someone who's telling you that what you may be thinking in your mind is achievable is not.
Yeah.
And someone you feel comfortable with.
Totally. By the way, that episode, when you brought that up, you were going to do it. I'm like, this is the dumbest episode ever, of course, every time when I'm like criticizing you. And you're absolutely right. It was one of the best episodes we ever did.
Oh, I recommend everyone listen to that episode.
It was very good.
Yeah.
Yeah.
Yep. So let's talk about, you found your surgeon, or you found several surgeons, hopefully, and you're going to interview them. You go to a consultation. Some things you should expect. They're going to take a full medical history. As we discussed, you need to be healthy enough for surgery. Make sure you don't have any contraindications to having this procedure done. You don't have a history of smoking in the recent history or in your recent past. All your previous surgeries. These are times when it's important to tell your doctor, like, oh yeah, I've always had a numb hand. So that after surgery, when you have a numb hand and you had lipo on your arms, we don't think that you have lidocaine toxicity.
I'm just laughing you pulled that one out.
Yeah.
Like, oh yeah, I did have a terrible nerve injury when I was 10 years old.
Tell me about your botched carpal tunnel that gave you a numb hand.
Yeah.
When I ask you if you can feel your hands after surgery and
Very
you say
funny.
no.
No, but it is important. Like, I think, and we talk about this a lot, this is just basic medicine stuff, but transparency and honesty with your surgeon is super important, especially when there's procedures involved.
Yeah. Well, and they should care. I mean, this is still surgery.
Right.
Even if it's done in office with you awake, it's still surgery.
In our case, we can say from our perspective, we really do care about you as the patient a lot. And it is really hard when you don't give us all the information, because all we can do is ask you that, or we can look at medical notes that were given to us. But sometimes people have kind of things that they forgot to tell us. So just really think about it before you go in to make sure you give all that information during your consultation.
The other thing they'll do is discuss your options. They'll probably recommend what they think is their best course for you, what your expected outcome could be, provide you a quote, review the risks and potential complications, which we're going to talk about in part 2. Look at before and after pictures of similar expected outcomes. This is where it's important not to go in saying, I want to look like this. Go in and say, do you have pictures you can show me of someone in my age group with my skin integrity, with, fat similar to mine?
Yeah.
Yeah, because that's going to be far more powerful. And of course, they're going to answer any questions that you have. What are some good questions that someone should ask their surgeon?
I love these questions. Mm-hmm. I feel like for all our listeners, we should send these as like note cards.
Well, they're always linked. Nils always links
printed out.
Mm-hmm.
Okay.
Yep.
First and foremost question, which I find very important, are you certified by the American Board of Plastic Surgery? Plastic surgeons along with dermatologists, invented liposuction. Plastic surgeons, board-certified plastic surgeons are the primary purveyors of liposuction. There's a lot of people now that are not plastic surgeons that offer liposuction. Mm-hmm. So they may be okay. I don't think so, but I think
your mileage is going to vary.
Yeah, I would. If you just want to be a betting person or a smart person, a logical person, you would go to someone who's board certified and well trained. Am I a good candidate for this procedure? Such a great question. Because you may say, hey, I don't like how this looks, or I want this better. And saying, do you think I'm a good candidate for liposuction in these areas that concern me? And they may say, no, I don't think you are. I think you need a tummy tuck, or you need a brachioplasty instead of liposuction.
Well, we get that a lot. What we'll say is, you're not a great candidate in this area, but you're an amazing candidate in this area.
100%.
This is where you should spend your money. Yeah.
And this is a side point. We'll talk about this later, but if you're already doing liposuction in one area and it's reasonably priced, you can do it in another and you're a good candidate there. Why not? Because you're already recovering.
Yeah.
What surgical technique do you recommend for me? And along that line is, what kind of technology would you recommend for me with the liposuction if they do offer that? Will weight gain or loss affect my results? Such an amazing question. Mm-hmm. Amy, how would you answer that?
Yes. How will it? It depends. It is really what the answer is. That's why we want people to be at a happy weight. If someone comes in and says this is going to jumpstart again my 50-pound weight loss, let's think about that. And absolutely, weight gain after this procedure, as we discussed with jar of marbles, is going to affect your, maybe not even the results of the area itself, but it's going to affect your overall body contour, which is going to affect your results.
And then weight loss actually might affect your results. Mm-hmm. That may be even more problematic for the results themselves.
That's what I mean. You don't use this to jumpstart your weight loss.
Yeah. What can I do to maximize my recovery and results? Do we have a good episode on that? This one. There's so many things you could do. Amy is, I called her a recovery ninja. I think that's probably appropriate. Mm-hmm. Amy, do you like that term?
I like that term.
Okay.
Yeah, I like it. I'll take that one.
Here, you take the rest.
So the other thing that's important to ask is what kind of help you're going to need during your recovery, and for how long will you need someone with you? Because that's going to vary based on your surgeon's requirements. Where will you perform my surgery? Will I be awake? What are the possible risks and complications? This is a big one. How are complications handled? And something I think people don't always think about with any surgery is, how can I expect my body to look or age over time? And that's something people usually say, well, how long will my results last? Well, the answer to that is they will last forever. It's not like there's some magic wand that when the clock strikes midnight on this day, your results reverse themselves. And we did have a patient tell us that a doctor told her that her results would last for 3 years and then go away from liposuction.
The funny thing, it's so inane to say that, but when they put a year amount, that's so outlandish.
Right. This isn't to tire.
At least say 12 years. Why 3 years? Yeah. That's the funny part. You know what I'm saying, Nils? Yeah. It's what was in their brain when they said that to the patient?
But these procedures, as with any procedure, it's not going to stop aging. Your body's going to continue to age. So that's a good question to ask. It's a good question to ask.
A couple more questions not on here. Can I have liposuction again? Yeah, you can. Can you do liposuction in the same area?
But again, it's not for weight loss.
Yeah. Yes, you can. You can do touch-up procedures there. Is there any scarring with liposuction? We'll get into that with the surgery, but there's just small incisions. That's what's nice about it. And can liposuction have bad outcomes? And we're going to talk about that in our next.
What are complications?
Yeah. We'll talk about that a lot in our next episode. It definitely can, especially warning if you go to someone who doesn't specialize in it, who's not focused on it, who's not caring the way they do the procedure itself. We've seen some pretty disastrous outcomes for people that have gone, unfortunately, to non-board certified plastic surgeons.
Yeah. You got to, what does that, pay to play?
Got to pay to play.
Got to pay to play.
You got to pay the cost to be the boss.
Yeah. I like that. That. Man, we are just full of puns today. This is our November, our winter energy, right? This is our winter vibes, or whatever they call it. I had surgery
today, so I got a little alpha going on. Yeah. Sorry.
Well, so that wraps up part one. Yeah. And in part two, we are going to talk about the actual details of surgery. So what is liposuction from a surgical standpoint? What happens during surgery? Important things you should know about risks and complications, and all about recovery. So those are all things that are coming in part two.
Are we going to talk about the technique? Man, that's what I've been waiting for.
That's all the part two. That's the about the surgery.
Yes.
Yeah.
Yes.
Yeah. So this is, as I mentioned at the beginning, this is November 1st. I still have not had candy corn yet this year.
Are you serious?
I'm serious.
Even though you're on your reversal?
I'm on my reverse diet now. Yeah, I've finished competing for the season, but I want to make some of the turkey candies, you use the candy corns as the feathers.
Oh, I love it.
Mm-hmm, I love those. So Thank you.
I have not had candy corns either. We have it at our house, and I didn't eat it. Is that un-American or something? Should I get therapy?
I mean, candy corn is not for everyone, Dr. Martin.
Yeah, I try. I want to be a candy corn lover. I'm really trying hard.
Shout out to Jenny, candy corn and peanuts.
Yes.
Mm-hmm. All right, everyone. So thank you so much for listening. Make sure you do follow us so you get notified when our next video, part 2, goes up. You can find all of our social media handles here. We're basically everywhere at Jason Martin, MD, and at Beauty and Surgeon Podcast. Also, and I'm going to say this at the beginning of our next one, I've been on several podcasts lately. So if you would like to see me on the Hormones for Me podcast, I was on in December or in October. Time. I was on in October, and then I also am going to be on in just a few days talking all about men and women's libido and sexual health. So part 1 that we did was all about men, and then the one that's coming out this week is actually all about women.
Oh, that's smart.
I was also on the Scott Mize podcast again and the Natty I Swear podcast. So if you're interested in hearing more about my Nils, you look like you're going to say something.
Yeah, you've linked those in our
I have
as well in the Jason Martin YouTube channel. So
if you go to the posts or the community tab.
So when you do those, they'll be on our site. They still take you to their site, but it's a good way to find them if you're interested.
Yeah.
I'm sorry to be a Luddite, but what the hell is the community site? Is that on our channel?
Yeah. It's a tab.
You can put someone else's video.
Oh, cool. I didn't even know that.
So, posts.
Maybe I should go on our channel and actually look. That's awesome. If you're
ever on anything else or on the news or anything else, we make sure to put
it on the
channel so
cool.
people can find it.
Yeah, it's on the community tab. So
nice. All right, go to our community tab.
That's where you can also find me if you want to hear me talking about other things that are not plastic surgery. So
yeah,
thank you.
You're like a Renaissance woman.
I'm a Renaissance woman.
You have a lot of talents. Hormones, when it comes to hormones, I would listen to you over most other people. I know you're not like a quote unquote hormone specialist, but you're as close to it as possible.
Yeah. Well, and I do know a lot about erectile dysfunction. So yeah. All right.
That's a whole other podcast.
That was what I talked on Hormones for Me about, was about erectile dysfunction.
Yes.
Yeah.
I like how you call it a renaissance and not an influencer.
Right. I'm not an influencer. She is not an influencer.
On. You got your own channel.
Yeah, and I'm the worst at it. I don't bring my camera anywhere. All right. So we will see you here next time.
The influencers are signing off.
The world's best YouTubers are signing out.
Later.